Okay, we're gonna go over the equipment. So I have gloves so that I can protect myself and wear my PPE. I have hand sanitizer so I can sanitize before I get into the procedure. I have tape and Coban, depending on what the patient wants. We can do tape to hold the bandage on or Coban the venipuncture point afterward. I have alcohol prep pads so that I can clean the skin before I puncture. I have gauze so that I can place gauze over the site after the venipuncture is over. A tourniquet to help the veins stand out. I have my blood collection set, my butterfly collection set that I'm going to use to perform the venipuncture. I have 2 3-milliliter syringes that I will use to draw the blood. I might only use one, but sometimes you need 2. I have a blood transfer device that I will use to transfer the blood into the tubes from the syringes. And then I have various blood collection tubes that will collect the blood after I'm done drawing it. Lastly, I have a heat pack that I'll place on the patient's hand so that their veins will pop out for me. And I will go through how to set everything up and then we'll show you the procedure. Okay, we have gone through the equipment and now I'm going to show you how to put things together and perform the venipuncture on a live patient. I have the patient warming their hand with a heat pack so the veins pop out a little bit better. I have also hand sanitized and put on my PPE. As the patient's hand is warming, we are going to grab our butterfly collection set and our syringe. We're going to unwrap them and put them together. Okay, and then I'm going to take this tourniquet and I'm going to apply it to the patient's forearm about 3 inches above the site so that we can get some veins to pop out for us. Sorry. You okay?
Yeah.
Okay. So we can see that we have some veins that are going to stand out. A lot of times you'll look up in the top of the wrist. She has some really good ones right there. I'm going to demonstrate lower in the hand so we can see kind of how it looks when we pull traction. So when we're pulling traction on these veins, what we want to do is straighten them out towards ourselves. So I'm going to pull traction down over the knuckles so that the vein straightens out in this section here. And then I still have space and I'm not in my own way so that I can get a good solid base when I'm poking. While we're getting ready to poke, I'm going to clean the site using aseptic technique. So we have our alcohol swab. We're going to start in the center of this vein. And then we're going to work our way outward around to the outside of the hand. As that dries, I'm going to prep my needle set. So I have it put together with the syringe on the end. I'm going to detach the syringe on the inside of the barrel so that it's not sticky as I'm pulling pressure into it. And then I'm just going to check my butterfly needle and make sure that there's no bent tips or barbs or little fuzzies or metal shavings or anything on the end of it. Everything looks great. I'm going to check the hand to make sure it's dry without touching where I've already cleaned. Does it feel dry to you?
Yeah.
Okay. And then I'm just going to pull my traction again. So I'm pulling traction toward myself. I'm getting the vein to straighten out. So I'm pulling traction toward myself over the knuckles. I'm going to get a nice solid base. And then I'm just going to venipuncture here in 3, 2, 1. I've got flash in the needle. And I'm just going to hold it nice and secure right here so it doesn't twist around or so I don't accidentally pull it out. And then I'm going to pull into my syringe. This is a 3 milliliter syringe. And you don't have to go super slow, but you don't want to pull it so fast that the blood is chasing the plunger. You want to pull it nice and steady. Once it gets to 3 mils, if you're going to swap out your syringe, you can do that. I'll show you how. We'll take a new syringe. We're going to kink the line of our butterfly needle. And then we're going to twist off and place our syringe next to us if we can, and we'll put our new syringe on. We want to make sure that we're keeping everything as close to the hand as we can because the tubing will pull the needle out if you're not careful. So then we can pull into our new syringe and fill that second one up. For the purpose of demonstration, I'm not going to fill it all the way up, but now since we're finished with our venipuncture, I will pop my tourniquet off. I'm going to fold my gauze into quarters so it's a little tiny square. That way the pressure is localized to one spot. And then I'm going to pull the needle out quickly without applying pressure here. So there's no pressure. We're just going to set this lightly on top. 1, 2, 3. Will you please hold that for me? Yeah. So now I have an exposed needle. We're going to go ahead and pull that into its sharps, into its safety. And then we can dispose of this entire butterfly set into the sharps container. Now that I have 2 syringes full of blood, we're going to transfer them into our tubes. So I have my transfer here. Take the transfer out and attach the tube you pulled first because this is going to start clotting on its own. So you want to make sure you get that transferred as fast as you can. I have my tubes in the order of draw, starting with a red. We're going to start with red and we're just going to put in, let's say 1.5 milliliters into this. And then we're going to invert. We'll fill our green next, putting the rest into the green, inverting. And then we'll dispose of this syringe in the sharps container as well because it's now a biohazard. And then we have our second syringe, holding it upright so the air bubble goes to the top. We're just going to fill our last tube up. And you can help it out if it goes pretty slow. Now that all that blood is in there, we're going to invert this last tube and then we're going to check on our patient, placing our sharps in the sharps container first. We're going to check to make sure that there is no more bleeding and that we're clotting accurately. We'll just keep that gauze on there. Do you want Coban or tape?
Whatever works.
Let's do Coban. And then we will either Coban or tape over the gauze. Perfect. Once we have finished our venipuncture and put the bandage on the patient, we will clean up everything that we have, trash, all caps, our tourniquet, and make sure everything gets thrown in the garbage. And then we'll take our gloves off, hand sanitize, and we're done. Thanks for joining us and watching our procedure on venipuncture in the hand. Thanks for watching. Please like and subscribe. Leave a comment if you have any questions, and we'll see you on the next one.